Hi friends, as you all know that we have started our preparation for the upcoming JIPMER examination, and this video also contains 15 very important questions which I have selected from different nursing subjects and 5 GK questions which can be asked in the upcoming JIPMER examination, and it will helpful for you for the other recruitment exams like AIMS, NORCET, ESIC, etc. So once again, welcoming all you back to our channel, the Nurse channel, and I request everyone who are watching this video to watch the video till the end without skipping, because explanation also is very important. Okay, so without losing time, I am starting the video, and before that I request everyone who are watching this video and who have not yet subscribed our channel, kindly subscribe this channel and share about this platform to your nursing friends. So straight away moving on to the questions.
So we'll start with the first question in this series. So the first question is on the screen right now, and the question is: an infant presented with projectile vomiting after feeding. Examination reveals a swollen abdomen and a palpable mass in the middle upper right quadrant. So what is the most likely health problem? So here the question is to identify or diagnose the health problem for an infant who presented with projectile vomiting after feeding, and there is a swollen abdomen, a palpable mass in the right upper quadrant. So what is the diagnosis? So the options for you are: the first option is intussusception, second option is pyloric stenosis, third option is gastroesophageal reflux, and the final option is diaphragmatic hernia. So what health problem is most likely? So here the answer for the question is obviously option number B, that is pyloric stenosis. Okay, so the features what we have mentioned in the question is typical for a pyloric stenosis, and we will see what is a pyloric stenosis. It is a narrowing of the opening from the stomach to the first part of the small intestine, that is a from the pylorus. Okay, so it's a narrowing of the opening from the stomach to the first part of the small intestine. So symptoms include projectile vomiting without the presence of bile. So the bile won't be there and projectile vomiting will be there, and this most often occurs after the baby is fed. Okay, so the diagnosis may be made by feeling an olive shaped mass in the abdomen. Okay, so from this explanation you are getting many information, like olive shaped mass in the abdomen is a diagnostic of pyloric stenosis. Then projectile vomiting after the baby is fed, that is a symptom of pyloric stenosis, and the other features what we have explained in the question. Okay, so I think this question, the first question itself, is a very important and very informative question. Now we will move on to the other options. That is the first next option was intussusception. So you know that intussusception, it is a medical condition in which a part of the intestine folds into the section immediately ahead of it. Okay, so that is intussusception. Then next comes the gastroesophageal reflux disease, or otherwise known as the GERD. It is one of the upper gastrointestinal chronic disease where stomach content persistently and regularly flows into the esophagus, resulting in symptoms and or complications. Okay, so you know regarding the GERD. And the final option was the diaphragmatic hernia. So it is a defect or hole in the diaphragm that allows the abdominal contents to move into the chest cavity. Okay, so that's all regarding the first question from the gastrointestinal system. Now we will move on to the next question in the series. The question is: the most likely side effect of methylphenidate is. Okay, so this is from the psychiatry. So the most likely side effect of methylphenidate. So just think about for which condition methylphenidate is giving and what are the side effects of the medicine. So the options for you are: option number A, insomnia; option number B, initial increased hyperactivity; then option number C, lethargy; and option number D, hypertension. So which is the most likely side effect of methylphenidate? So you know that methylphenidate is used for which disease? That also is another question which can be asked. So the answer for this question is option number A, that is insomnia. Okay, so methylphenidate, otherwise known as the MPH, it is the most widely prescribed central nervous system stimulant medication which is used to treat ADHD, that is attention deficit hyperactivity disorder, and to lesser extent for the narcolepsy. Okay, so the common adverse effects we can see with the methylphenidate is tachycardia, palpitation, headache, insomnia, anxiety, hyperhidrosis, weight loss, decreased appetite, dry mouth, nausea, and abdominal pain. Okay, so these are all the common adverse reactions, and from these, insomnia was the option what I have given in the question. So the answer for the question is insomnia. So methylphenidate for attention deficit hyperactivity disorder. Okay, so moving on to the third question in our series, very important question. A systolic ejection murmur at the right upper border is characteristics of dash. So the question is regarding a murmur. So the question is systolic ejection murmur at right upper border. Okay, so the options for you are option number A, aortic stenosis, option number B, aortic regurgitation, option number C, mitral stenosis, and option number D, mitral valve prolapse. So in which case we can see a systolic ejection murmur at right upper border. So what is the answer? Very important. So from in these options, for each disease there are typical murmurs can be observed, so that we will be explaining in the explanation session. So right now the answer for this question is option number A, that is aortic stenosis. Okay, so in aortic stenosis what is happening is the typical murmur of aortic stenosis is a high pitched diamond shaped crescendo decrescendo mid systolic ejection murmur, which is best heard at the right upper sternal border radiating to the neck and carotid arteries. Okay, so this is a typical murmur of aortic stenosis, that is mid systolic ejection murmur. Okay, so that term you should remember, very important. Then what about regarding the other options? So the another option was aortic regurgitation. So in aortic regurgitation, the typical murmur is a descendo early diastolic blowing murmur. Here the murmur is diastolic murmur, which is best heard on the left lower sternal border and around the third and fourth intercostal spaces. Okay, so aortic regurgitation, it will be diastolic murmur. Okay, diastolic murmur, and the position already I have explained. Then another option was the mitral stenosis. So in mitral stenosis, there will be diastolic murmur, and it is of low pitch, rumbling in character, and it is best heard at the apex of the heart with the patient in the left lateral position. Okay, so if the patient is having the mitral stenosis, the typical murmur is the diastolic murmur. Okay, and the position is at the apex of the heart, and the patient need to be positioned in the left lateral position. Okay, so that is mitral stenosis murmur. And the final option was regarding the mitral valve prolapse. So in mitral valve prolapse, there is the mid systolic murmur of mitral regurgitation. Okay, because of the mitral regurgitation, we can hear a mid systolic murmur. Okay, so from this question, we are getting information regarding the typical murmurs which can be seen in 4 different cardiac conditions. Okay, so that also is very informative and helpful for you. Now we will move on to the next question in the series, that is the 4th question, and the question is, which among the following are the characteristics features of lead poisoning? So the question is regarding lead poisoning, and the question is characteristics feature of lead poisoning, and the options for you are option number A, developmental delay, constipation, anorexia, clumsiness, and pallor. Option number B, confusion, delirium, seizures, lethargy, stupor, and coma. Option number C, respiratory depression, obstruction, pulmonary edema, and tachypnea. And final option is peripheral circulatory collapse and heart failure. So just think about the lead and how it affects our body, and you can easily answer this question. So the answer for this question is option number A, that is developmental delay will be there, constipation, anorexia, clumsiness, and pallor. So we know that lead poisoning, otherwise known as the plumpism and saturnism, okay, it is a type of metal poisoning caused by lead in the body. So the symptoms may include abdominal pain, constipation, headache, irritability, memory problems, irritability, and very important, this is a tingling in the hands and feet. Okay, tingling in hands and feet. So these are the characteristic features of lead, otherwise known as the plumpism or saturnism. Okay, so that's all regarding the question with lead poisoning. Now we will move on to the 5th question, that is a important GK question, and the question is, in which year the first census was conducted in India? So in which year the first census was conducted in India? And the options for you are option number A, 1884, option number B, 1872, option number C, 1881, and option number D, 1891. So when was the first census conducted in India? So whatever it is, we have to by heart the answer. The answer is option number B, that is in 1872. Okay, 1872. Now we will move on to the next question, that is the sixth question from central nervous system, and the question is CSF in bacterial meningitis may appear as. Okay, so it's a very direct, simple question. So CSF appearance in bacterial meningitis will be, that is a question, and the options are pink viscous appearance, clear fluid appearance, turbid appearance, and finally blood tinged appearance. Very easy question, direct question. So CSF in bacterial meningitis, how it will be? So obviously answer is option number C, that is a turbid appearance will be there. Okay, so we know that the turbid or the cloudy CSF can reflect infection within the CSF, and a red, pink or blood stained CSF indicates the appearance of blood, and blood may originate from a traumatic tap, that means during the lumbar puncture or subarachnoid hemorrhage, intracerebral hemorrhage or cerebral infarct. Okay, so pink, red CSF or the blood CSF because of trauma, then turbid or cloudy CSF can reflect the presence of infection within the CSF. Okay, so that also was a very simple but important question. Moving on to the seventh question in our series, and the question is, which of the following would the nurse expect to find in the initial physical assessment of a patient with severe iron deficiency anemia? So the question is, initial physical assessment of a patient with severe iron deficiency anemia, what we can assess. Okay, so the options are option number A, clubbing, option number B, koilonychia, option number C, Bu's line, and option number D, paronychia. So in the nails of the patient, what assessment can be seen if the patient is having severe iron deficiency anemia? So that is a question for you. So clubbing, koilonychia, Bu's line or paronychia. So first of all, you should understand what all these terms, and you can answer this question very easily. So for this question, answer is option number B, that is koilonychia. Okay, so what is koilonychia and why it is happening in severe anemia, that we will see in the explanation. So you can see the picture right now here. Koilonychia, otherwise known as the spoon nails. Okay, it is otherwise known as the spoon nail. Why? Means the nail plate is thin. You can see the nail plate is very thin and has a concave appearance like a spoon. So it is thought to occur. Why? Means this is due to the upward deformation of the lateral and distal portion of the pliable iron deficient nail plates under mechanical pressure. Okay, so this is the reason why spoon nails or koilonychia is happening in severe iron deficiency anemia, and this is the picture of spoon nail. So the other options we will see. So this is Pakka, you know that this is known as the nail clubbing. This picture you can see. So nail clubbing, also known as the digital clubbing or clubbing, it is a deformity of the finger or toenails associated with a number of diseases, mostly of heart and lungs. So the disease conditions are occurring because of the low oxygen in the blood, and it could be a sign of various types of lung diseases. And nail clubbing is associated with inflammatory bowel disease, cardiovascular diseases, liver diseases, and also with AIDS. Okay, so these are the conditions where we can see nail clubbing. Okay, I think that also clear for you. Now we will see the another option. What is a Bu's line? Okay, Bu's lines, these are the horizontal ridges as you can see in the picture, or dents in one or more of your fingernails or toenails. And the conditions which are associated with Bu's line include uncontrolled diabetes and peripheral vascular diseases, and as well as illnesses associated with a high fever such as scarlet fever, measles, mumps, pneumonia, etc. Okay, so Bu's line, these are horizontal ridges or dents, and these are associated with diabetes, peripheral vascular diseases, and diseases with high fever. Okay, so I think Bu's line also is clear for you. Now another option was the paronychia. Paronychia, you can see in the picture, it is the infection. See, this is an infection of the tissues which are adjacent to the nail, most often a fingernail. Okay, and it is caused by injury or irritation such as hangnail, cuticle damage, or continually wet hand. So this is paronychia. So from this question we are getting 4 important terms related to the nail pathology and the conditions in which these nail pathologies can be seen. Okay, so moving on to the next question in our series, that is the 8th question. So another little confusing question but very important. A female patient has been advised that laboratory test confirm herpes simplex virus type 2, HSV type 2. So the nurse should teach the patient that a Papanicolaou test or the Papsmear is recommended. So you will have a confusion regarding this question, why for HSV type 2 Papsmear need to be done. So that we will explain in the explanation session. So the question here now is how frequently the test is recommended for a patient already diagnosed with the herpes simplex 2 type 2 infection. Okay, so the options for you are, the first option is every 6 months if symptoms persist despite treatment. Then option number C, every year even if asymptomatic. Option number C, whenever symptoms recur. And final option is every 3 years if other pap smears have been negative. So how you will recommend for further testing for a patient diagnosed with herpes simplex virus type 2. So that is a question for you. So what is the answer? So the answer for this question is option number A, that is every 6 months if symptoms persist despite treatment. Okay, so this is a recommendation for the further testing. So why we have to, what all things we can observe in a pap smear test? So we know that pap smear helps in detecting of at least, or it gives a clue to the presence of sexually transmitted infections such as trichomoniasis, candida, actinomyces, herpes simplex virus, cytomegalovirus, and obviously human papilloma virus. Okay, so we will get a clue, or where we can detect the presence of these organisms which causes STIs, that is sexually transmitted infections such as trichomoniasis, candida, actinomyces, herpes simplex virus, cytomegalovirus, and human papilloma virus. Okay, so pap smear is not only for the human papilloma virus, it can detect other infection also. Okay, so that I think it's an additional information for you. Now we will move on to the 9th question in our series, and it is a very important general knowledge, and the question is, We Think Digital. It is a digital literacy program of which global technological company? So We Think Digital, it is a digital literacy program of which global technological company? And the options for you are option number A, Google, option number B, Facebook, option number C, Apple, and option number D, Amazon. So We Think Digital is a digital literacy program of which global technological company? So the answer for this question is option number B, that is Facebook. Okay, so we'll move on to the next question, and before that, We Think Digital, it is a global digital literacy program of the technology major Facebook, and the program was launched in 2019 with an aim to overcome the gender imbalance on the internet space. Okay, to maintain a gender equality, they have initiated this this one. Okay, now we'll move on to the next question in our series, that is a 10th question, and the question is, when administering an enema to an adult patient, how far should the nurse insert the tubing into the rectum? So how far a rectal tubings can be inserted into the rectum while administrating an enema? That is a question for you, and the options are option number A, 2.2 to 4.4 centimeter or 1 to 2 inches. Option number B, 4.4 to 6.6 centimeter or 2 to 3 inches. Option number C, 6.6 to 8.8 centimeter or 3 to 4 inches. And option number D, 8.8 to 1 centimeter or 4 to 5 inches. So what is the answer? 1 to 2 inches, 2 to 3 inches, 3 to 4 inches, or 4 to 5 inches. So the answer is obviously option number B, that is 4.4 to 6.6 centimeter or 2 to 3 inches. Okay, so we know that we have to gently insert the rectal tube tip into the rectum and advance it to 2 to 4 inches, and never advance forcefully if any resistance is encountered. Okay, and encourage the patient to breathe slowly and deeply during the insertion so that the pain of the insertion can be reduced. And before that, we have to we can put a jelly for the easy insertion and to anesthetize that area. Okay, so these are the things that you have to see while inserting a rectal tube for administering enema. And the answer for our question is 2 to 3 or 2 to 4 inches we can insert the rectal tube. Okay, so moving on to the 11th question in our series, and the question is, an 82-year-old patient has Parkinson's disease, and during the assessment the nurse would expect which of the following actions to produce the most tremor activity of the hands. Okay, so the question you should understand first, So here the question is regarding the Parkinson's disease, and the question what here asked is in which way we can produce the most tremor activity from the patient from his hands. And the options for you are option number A, eating with a fork, option number B, resting hands in lap, option number C, standing with hands loose at sides, and option number D, rolling a small pill between the fingers. So among these options, among these actions, among these options, through which action we can elicit the most tremor activity in a Parkinson's disease patient. Okay, so it's an indirect application level question, very important. So what is the answer? So what is the peculiarity of tremors in Parkinson's disease? What are the criteria for diagnosing a Parkinson's disease? These all things we can think about and answer this question very easily. So what is the answer? So the answer is option number you can see the answer is option number B, that is resting hands in lap. Okay, resting hands in lap. So we know that the diagnosis of probable Parkinson's disease requires bradykinesia, that is one thing, and one of the following additional features, that is rigidity, rest tremor. So this is very important, resting tremor. So in the options, if you are seeing, we can see that all other activities are one or the other way it is involving some sort of actions, like eating with a fork, standing with hands loose, then rolling a small pill. All these options, all these include some sort of actions, but the option number B is a resting hand in the lab. That means we can elicit the resting tremor and we can make a proper diagnosis of Parkinson's disease with the presence of other features like rigidity or postural instability, bradykinesia, etc. Okay, so I think this is very important. Now we will move on to the next question in our series, that is the 12th question, and the question is, which among the following is a sign of thoracic outlet syndrome? So which among the following is a sign of thoracic outlet syndrome? So that is a question for you. So first of all, think about what is a thoracic outlet syndrome. So the options for you are, first one is the Allen's sign, second one is the Adson's sign, the third option is the Alexander's law, and the final option is the Askoff body. So which among the following is a sign of thoracic outlet syndrome? So through the process of elimination also we can come to the answer for this question. So anyway, we will see the answer for the question first. The answer is option number B, that is Adson's sign. Okay, so we will see what is a thoracic outlet syndrome and what is an Adson's sign. This is very important. So thoracic outlet syndrome, otherwise known as a TOS, it is a condition in which there is compression of the nerves, arteries or veins in the superior thoracic aperture, which is the passageway from the lower neck to the armpit, also known as the thoracic outlet. Okay, so in the thoracic outlet there will be compression of the nerves, arteries or the veins, okay, in the thoracic outlet. So this syndrome is known as the thoracic outlet syndrome. So how we can elicit Adson's sign? What is Adson's sign? Adson's sign, it is a loss of the radial pulse in the arm by rotating head to the ipsilateral side, that means the same side, with extended neck following deep inspiration. So we have to tell the patient to take a deep inspiration, then we have to rotate the head to the ipsilateral side, and we can see that there will be absent radial pulse in that particular arm. So that sign is known as the Adson sign, and if Adson sign is positive, that is indicative of the thoracic outlet syndrome. So the other options we know that what is the Allen's sign. Allen's test or the Allen's sign is a test for the presence of palmar ulnar radial anastomosis or the palmar arch. So this we are before taking ABG we have to do for this test. Okay, that is the Allen's test. Then next one is the Alexander's law. What is Alexander's law? So it describes the nystagmus in the vestibular lesions. Okay, so Alexander's law describes nystagmus in vestibular lesions. Then final option was the Askoff bodies. So you know that Askoff body is related to the rheumatic fever, and it is a foci of interstitial inflammation in the myocardium and elsewhere. Okay, so that is the Askoff body which is related to rheumatic fever. Okay, so Adson sign is the, so what we have explained here, that is the Adson sign is a sign for thoracic outlet syndrome. Okay, now we will move on to the 13th question in our series, another important, very important question, and the question is, the term blue bloater refers to which of the following conditions? So the question is, the term blue bloater refers to which of the following conditions? So the options are, first one is the adult respiratory distress syndrome, option number B asthma, option number C chronic obstructive bronchitis, and option number D emphysema. So what do you mean by blue bloater? Blue bloater. Slightly confusing. So this was a term which was used earlier for some disease. So that we will explain in the explanation session. So time being, the answer for the question is option number B, that is a C bronchitis, that is chronic obstructive bronchitis. So some terms we will learn now. So that term blue bloaters represent those who have chronic bronchitis, and the pink puffers refers to the patients with represents the patients with emphysema. So why blue bloaters? So as the name indicates, in chronic bronchitis we can the bronchitis can cause severe breathing difficulty and decreased oxygen in the body. So this can result in the development of patient's skin in bluish tint or lips taking a bluish tint. So that's why they are known as blue bloaters. Then why pink puffers? So emphysema causes the people to have difficulty catching breath. So there will be breathing difficulty, and as a result the patient gasp in between or take short fast breaths. So this will cause them temporary redness or pink coloring on their cheeks and faces. So that's why emphysema patients were called as pink puffers, and chronic bronchitis patients were called as blue bloaters. Okay, so these are the two terms that you should understand. Now we will move on to the next question in our series, that is the 14th question, and it is a general knowledge regarding the measurement. And the question is, knot is a unit of, K-N-O-T, knot is a unit of dash. Option number A speed, option number B distance, option number C depth, and option number D acceleration. So knot is a unit of dash. So the answer for this question is option number A, that is speed. Okay, so 1 knot is equivalent to 1.852 kilometer per hour. Okay, so 1 knot is equivalent to 1.852 kilometer per hour. Okay, so usually for sailing purpose, for the ship and all, they used to tell this much knot. Okay, so that is a good question. Now we will move on to the next question in our series, that is the 15th question. So another very important question. What is the theme of World Tuberculosis Day 2022? So this year's 2022's theme for the World Tuberculosis Day. So the options are, the first option is invest to end TB, save lives. Then option number B, the clock is ticking. Option number C, it's time. And option number D, it's time to end the stigma. So among these, which is the theme of World Tuberculosis Day 2022? So you should understand one thing, almost all, I think 3 of these options are theme for World Tuberculosis Day in different years. Okay, so what is the answer for this question? Answer for this question is option number A, invest to end TB and save lives. This is the theme of World Tuberculosis Day 2022. So we know that it is celebrated every year on 24th of March, and invest to end TB, save lives is the theme for this year. And each year we will commemorate the World Tuberculosis Day on March 24th to raise the public awareness about the devastating health, social and economic consequences of TB, and to set up efforts to end the global TB epidemic. Okay, so the other options, the clock is ticking, it was the theme for 2021 World Tuberculosis Day, and in 2020 the theme was it's time. Okay, so I think that also was very informative question for you. We will move on to the next question in our series, that is the 16th question, and the question is, which of the following condition is not associated with microcytic anemia? So another very important question. So which of the following condition is not associated with microcytic anemia? Microcytic, that is small size red blood cells. Okay, so the options for you are option number A, iron deficiency anemia, option number B, aplastic anemia, option number C, sideroblastic anemia, and option number D, thalassemia. So among this, which one is not associated? That is very important. Which one is not associated with microcytic anemia? So what is the answer? So the answer for this question is option number B, that is aplastic anemia. In aplastic anemia, RBCs will be mainly it will be macrocytes can be seen, but in all other options, iron deficiency, sideroblastic and thalassemia, we can see microcytic type. Okay, so we'll have a small explanation regarding this question. So we know that microcytic anemia is any of severe types of anemia characterized by small red blood cells called microcytes. So first of all, we should understand what is a microcytic anemia. So it is characterized by small red blood cells, otherwise known as a microcytes. And among the anemias, iron deficiency anemia by far is the most common cause of anemia in general, and it is of microcytic anemia in particular. Okay, so the most common cause of anemia in general is the iron deficiency. Okay, so that is another information for you. Then another option was the aplastic anemia. That is the answer for the question. We know that aplastic anemia is a disease in which the body fails to produce red blood cells in sufficient numbers. So there will be a reduction in the number of RBCs, WBCs, everything. So there will be a failure in the production of the blood cells in sufficient numbers. So aplastic anemia is one of the causes of the normocytic, normochromic anemia. Many times it will be normochromic, normocytic, with some macrocytosis of remaining RBCs. Okay, so the remaining RBCs will be macrocytes, not microcytes. Okay, so that's why that is the answer for the question I have asked now. Then what is the sideroblastic anemia? Sideroblastic anemia, or the sideroacrustic anemia, it is a form of anemia in which the bone marrow produces ringed sideroblast rather than healthy red blood cells. Okay, so it will be producing ringed sideroblast instead of healthy RBCs. So sideroblastic anemia is known to cause microcytic and macrocytic anemia depending upon what type of mutation led to it. Okay, so sideroblastic anemia can cause microcytic, but it can cause macrocytic anemia also. So here the answer for our question is aplastic anemia. Okay, so I think that question also is clear for you. Now we have explained about the thalassemia also. Thalassemias are common cause of microcytic anemia, and these are due to the impaired synthesis of globin protein component of the hemoglobin. Okay, so I am not going in depth about thalassemia and all. It is a very vast important topic. You can refer it later. Okay, so I think that also was very informative for you. We'll move on to the 17th question, that is from the GK session, and the question is, which is the largest Indian museum? So which is the largest Indian museum? And the options for you are Nizam's Museum, option number B, Salarjung Museum, option number C, AP State Archaeology Museum, and the final option number D, Indian Museum in Kolkata. So which is the largest Indian museum? So the largest Indian museum is option number D, that is the Indian Museum, Kolkata. And I believe that this is the first museum in India. I believe so. Okay, so this is the largest Indian museum in India. Okay, so moving on to the 18th question in our series, and the question is, inflammation of a sweat gland is known as which of the following terms? Inflammation of a sweat gland. And the options are, first one is colitis, option number B, fasciitis, option number C, hidradenitis, and option number D, pimillitis. So which term explains about the sweat gland inflammation of sweat gland? So it is, what is the answer? So the answer for this question is option number C, that is the hidradenitis. So we know that hidradenitis, it is a chronic skin condition featuring lumps in the places such as the armpits or groin, and the skin lesions will develop as a result of inflammation and infection of the sweat glands. Okay, so hidradenitis, it can be seen in the armpits or the groins, and it is occurring as a result of inflammation of the sweat glands. Okay, so what is a pimillitis? Pimillitis, it is an inflammation of the adipose tissues. Okay, inflammation of adipose tissue, that is pimillitis. I think these terms are new to you, so I think that was also useful for you. Now we will move on to the second last question from GK, and it is related to the NABH, and the question is, the first hospital to be accredited by NABH is? So which was the first hospital accredited by NABH in India? So the first one is the Tata Memorial Hospital, Mumbai. The second option is the BM Birla Heart Research Center. Then option number C, Apollo Hospitals, and the final option, Commando Hospital. So which hospital accredited first by NABH? So it is option number B, that is a BM Birla Heart Research Center. Okay, Now we will move on to the very last question in this series, and the question is very important from psychiatry. Akathisia can be treated with which among the following drugs? Okay, so akathisia. So explaining about akathisia, you know that akathisias are coming as a part of extrapyramidal syndromes when we are giving antipsychotics. You know that antipsychotics can cause extrapyramidal symptoms, and in that an important symptom is the akathisia. So if akathisia comes, how we can treat? That is a question for you, and the options are: first one is option number A, vitamin D; option number B, propranolol; option number C, baclofen; and option number D, dandrolene. So which is the drug which can be used to treat akathisia? So what is the answer? So the answer for this question is option number B, that is a propranolol. So propranolol, as you all know, that it is a beta blocker antihypertensive. Commonly it is used as an antihypertensive in the class of beta blockers. Then how it helps in reducing akathisia, that we will see. So first of all, we have to find out what is akathisia. So the patients with akathisia, they can't sit or stand still for a time. Okay, there will be motor restlessness will be there. So it is believed that the motor restlessness, which has been proposed as the possible result of an imbalance between the central dopaminergic and beta 2 adrenergic systems. Okay, so imbalance of central dopaminergic and beta 2 adrenergic systems. So the improvement in the akathisia from propranolol could thus be due to the beta 2 blocking property of propranolol. So we know that propranolol is a beta blocker, and thereby it reduces the motor restlessness which is happening in the akathisia. Okay, so apart from propranolol, there are studies like in even benzodiazepines can be used on a short-term basis for acute akathisias. But some other studies have shown like even benzodiazepines over a period of time can cause akathisia also. So the answer for our question is propranolol. Okay. So you are getting information regarding the extrapyramidal syndrome. This is through for schizophrenia patients, and all we used to give antipsychotics. Okay, antipsychotics can cause EPS, and in that akathisia is a thing. Okay, so in the options we have explained about the vitamin D, but it is not. I think we have explained told about vitamin D, but vitamin B can improve the akathisia symptoms. Okay, so with that we are coming to the end of this session. So as I usually tells the questions what we have explained today, I mean like 15 questions from the nursing subjects and the 5 questions from the GK are very important, and you can refer further about these questions and the other options what I have explained in this session. So hope this video was very useful for you. So stay tuned, we will be coming shortly with another set of questions very shortly. So till that time, signing out, say stay tuned. Thank you.